Today we're going to be going over the lower body mechanics.
Why are these lower body muscles so important? This project focuses on key muscles of the lower body that are essential for movement, stability, and strength. The quadriceps, hamstrings, gastrocnemius, and soleus. These muscles are fundamental for activities such as walking, running, and lifting. First up, we have the quadriceps. The muscle group actually consists of 4 specific muscles: rectus femoris, vatus lateralis, vatus medialis, and vatus intermedius. First up, we have the rectus femoris. It's a 2-joint muscle which goes from the hip to the knee. The origin of the rectus femoris originates at 2 points: the anterior inferior iliac spine, which is a bony prominence located at the front of the pelvis, and the superior margin of the acetabellum, the upper edge of the hip socket, which is where the femur meets the pelvis. It inserts into the tibial tuberosity, which is the bony prominence on the upper part of the tibia. The connection is made through the patellar tendon, which is the tendon that connects the patella, the kneecap, to the tibia. The actions of this muscle are: flexes the hip joint. The rectus femoris helps lift the high towards the torso by acting on the hip joint, a movement known as hip flexion. Extension of the knee joint. It also plays a key role in straightening the knee by contracting, which is primarily the function of the quadriceps as a group. Vastus intermedius. It's a single joint muscle which is at the knee. The origin is at the interior and lateral surfaces of the femur. The vastus intermedius originates along the front and outer side of the femur, which is the thigh bone, particularly from the upper 2/3 of its shaft. It inserts at the tibial tuberosity, the bony prominence on the upper part of the tibia, via the patella tendon, which connects the patella, the kneecap, to the tibia. Actions. It extends at the knee joint. The vastus intermedius is primarily responsible for extending the knee. It also contracts to straighten the knee, working in conjunction with the other quadricep muscles. The vastus lateralis. It's a single joint muscle and it's located around the knee. The origin is at the greater trochanter of the femur, the large bony prominence at the top of the femur on the outer side of the hip. Lateral line of the femur, the outer edge of the femur shaft extending downward. It inserts at the tibial tuberosity, the bony prominence on the upper part of the tibia via the patella tendon, which connects the patella to the tibia. The action. It extends the knee joint. The vastus lateralis is primarily responsible for straightening the knee by contracting as part of the quadriceps group. This action is vital in movements like walking, running, and jumping. Vastus medialis. It's a single joint muscle knee. The origin is medial side of the femur, the inner part of the femur, including the intertrochanteric line and the medial hip of the linear aspera. And it also originates at the medial supracondylar line, the bony line running along the lower part of the femur closer to the knee. It inserts at the tibial tuberosity, the bony prominence on the upper part of the tibia, which via connects the patella tendon to the knee to the tibia. Action. It extends the knee joint. The vastus medialis plays a crucial role in straightening the knee, particularly during the final phase of knee extension. It also stabilizes the patella. It helps maintain the proper tracking of the patella during knee movement, contributing to the knee stability and preventing misalignment or patella tracking disorders. These are the machine exercises that we did. On the upper left is the leg extension machine. It's targeting the quadriceps, focusing mainly on the knee extension. The position of your legs and foot placement can be slightly altered, which part of the quadriceps it's working. We also have on the upper left side, or lower left side, is the leg press machine. The target focus on that one was to control the motion and engage all part of the quadriceps, which emphasizes shifting slightly depending on the foot placement as well. Next, we have our body weight exercises. First up, we had wall sits, which are an excellent isometric exercise for the quadriceps. They target all 4 quadricep muscles with an emphasis on vastus medialis and vastus lateralis due to the positioning of your knees. Next up, we have lunges, which target the quadriceps by requiring knee extension during the push-off phase. The vastus medialis and vastus lateralis get a balanced workout with the emphasis on the vastus medialis when stepping forward. And lastly, we have barbell squats, which engage all the quadricep muscles. The depth of the squat and knee bend directly affect the activation of the vastus medialis and vastus lateralis, while the rectus femoris is engaged throughout.
Next up, we have the hamstring. The hamstring consists of 3 muscles: the biceps femoris, semidioris, and the semibranioris. They work together to flex the knee, extend the hip, and assist in rotating the tibia when the knee is bent. Bicep femoris is a 2-joint muscle at the hip and the knee. It originates at the long head, part of the pelvis, and the short head, the lateral lip of the linea aspera of the femur, or the thigh bone. It is inserted at the head of the fibula, which is the outer bone of the lower leg, with some fibers attaching to the collateral ligament of the knee. The action is it flexes the knee joint. The bicep femoris helps bend the knee by contracting, especially when the knee is extended. It extends the hip joint. The long head also plays a role in extending the hip, partially when the knee is straight. It also rotates the knee. It assists in rotating the knee outward, lateral rotation when the knee is flexed. Semtendinitis is a 2-joint muscle at the hip and the knee. It originates from the lower part of the pelvis, specifically the ischial tuberoso. The tendon sits just below the knee on the inner side of the tibia, forming part of the pes annuris, a tendon inserts of the 3 muscles. Action: it flexes the knee joint, contracts to bend the knee. It assists in extending the hip when the thigh is moving backwards, and it also helps rotate the tibia when the knee is flexed. It rotates the tibia inward, which is medial rotation. The semimembranosus is a 2-joint muscle at the hip and the knee. It originates from the lower part of the pelvis, specifically the ischial and the tuberoso. It inserts on the inner side of the tibia near the knee and also has fibers attaching to the posterior part of the knee joint capsule. The actions: it helps flex the knee joint, contracts to help bend the knee, it extends the hip joint, and it medially rotates the tibia. For our machine exercises, we did leg curls, which this machine focuses on isolating the hamstrings during knee flexion. The bicep femoris is involved, but the main focus is on the semiondotis and the semibraniotis being the primary targets. This is a key exercise for isolating the hamstrings. And then next for our body weight exercises, we have Romanian deadlifts, also known as RDLs, hamstring walkouts, and glute ham raises, which are a hamstring-focused workout. The RDL focuses on hip extension, primarily targeting the bicep femoris. As you hinge at the hips and lower your torso, the semiondoris and the semiombrosus engage to assist with hip extension and stabilize the movement. In hamstring walkouts, the hamstring walkouts target the hamstring by engaging them to extend the hips and control the movement as you walk your feet out while maintaining a bridge position. And then in the glute ham raises, the GHR is one of the best bodyweight exercises for isolating the hamstrings because it directly targets both the knee flexion and the hip extension, both of which are crucial for hamstring extension.
The next muscle is the calf muscles. These consist of the gastrocnemius, which is the larger muscle responsible for the plantar flexion and knee flexion, and the soleus, a deeper muscle that primarily aids in plantar flexion and stabilizes the body during standing and endurance activities. Together, they allow for movements like walking, running, and jumping. The gastrocnemius is a two-joint muscle at the knee and ankle. The origin, there is a medial head of the gastrocnemius, which originates from the medial condyle of the femur. The lateral head originates from the lateral condyle of the femur. The insertion, both heads insert into the calcaneus, which is the heel bone, via the Achilles tendon. The action, plantar flexes the ankle joint. The gastrocnemius is primarily responsible for pointing the toes, plantar flexion, when the knee is straight. Flexes the knee joint. It assists in bending the knee, which is knee flexion, especially in the foot, and the dorsiflexed, which is the toes pointed upward. It also stabilizes the leg. The gastrocnemius plays a stable role during walking, running, jumping, and help to propel the body forward. The soleus is a single joint muscle at the ankle. The origin, the soleus originates from the posterior surface of the tibia and the fibula, specifically the upper portion of both bones. It inserts into the calcaneus, the heel bone, via the Achilles tendon along with the gastrocnemius. The action, the plantar flexes the ankle joint. The soleus is primarily responsible for pointing the toes, which is plantar flexion, especially when the knee is bent. It stabilizes the body and plays a significant role in maintaining posture and stability during activities like standing, walking, running, especially during prolonged periods of weight bearing. The machine exercise we did was a leg press machine, but we used just our calves. The target focus was placing the feet at the bottom of the leg press platform and pushing the weight with your toes. Both the gastrocnemius and soleus are engaged. With the heels slightly bent, it helps focus more on the soleus, but the gastrocnemius still contributes to the movement. Our bodyweight exercises was the standing calf raises and little hops in place, which are pogos. The focus of the standing calf raises, you stand with your heels flat on the floor, then lift your heels off the ground, standing on the balls of your feet. This movement primarily targets the gastrocnemius when the heels are straight, but the soleus is also engaged, especially if you perform the movement slowly with control. The little hops in place target they perform small, quick hops in place, keeping your knees slightly bent and using the balls of your feet to push off the ground. The gastrocnemius will be responsible for the quick upward movement, while the soleus works in stabilizing during each landing. Thank you.